Hello, I'm Senator Maggie Hassan from New Hampshire. Throughout the COVID-19 pandemic, people all across the country have stepped up and supported their fellow Americans. Here in New Hampshire, community colleges and makerspaces are using 3D printers and laser cutters to manufacture face masks and clear plastic face shields for our frontline workers. Student groups like one at Kearsarge Regional High School organized events to provide vulnerable individuals with food and personal care items. And the Salem High School cheerleading squad held a parade outside a nursing home to help raise residents' spirits. These collective grassroots efforts, and so many others, are inspiring, but they aren't a substitute for strong federal action. This pandemic is devastating families and communities all across the United States. Millions are out of work, small businesses are closing, the infection rate is increasing, and more than 135,000 Americans have been killed by the virus. The administration's response is not working, and Congress must act now to provide additional relief. Since May, Senate Majority Leader Mitch McConnell has dragged his feet on providing Americans with the help that they need, even saying that he didn't feel urgency to act. Well, Leader McConnell's finally said that he's willing to work on additional legislation, but unfortunately, he's drawing red lines on what should be included in a new package. Democrats have been listening to people across the country and have put forward proposals that match the size and scope of the HEROES Act passed by the House now 2 months ago. These proposals would help save lives and begin to get our economy back on track. Our approach bolsters public health and delivers direct support for individuals and small businesses so that we can rebuild our economy. Our response starts with strengthening public health resources to help contain the spread of the virus, including increasing our capacity to test for the virus and to conduct contact tracing. A robust science-based response also includes truly adequate supplies of personal protective equipment. Months into this crisis, medical providers, nursing homes, and businesses still do not have the personal protective equipment that they need to be safe. If the administration continues to refuse to fully exercise its power to ramp up production of these vital supplies, Congress must require it. And our response must ensure that a plan is in place to effectively distribute and administer a potential vaccine at no cost to people who receive it, so that we do not see a repeat of the mess we have seen with COVID-19 testing and personal protective equipment. Next, we know that as communities grapple with public health impacts, individuals and employers continue to struggle with the severe economic disruption that this pandemic has caused. As part of our relief efforts, we should extend strengthened unemployment insurance, as well as provide further individual relief payments. We must also continue to partner with small businesses and nonprofits in their recovery, helping them with direct assistance through the tax code and through the Paycheck Protection Program. To limit further economic disruption, we also must give more support to state and local governments. Without significant federal support for state and local governments, millions of jobs will likely be lost, with the ripple effects felt throughout the economy. We can't allow that to happen. Congress must deliver this relief and provide flexibility for states to use this funding to backfill revenue lost due to COVID-19 and preserve jobs. Finally, we must recognize that helping childcare facilities and schools safely reopen where possible is critical both to our children's development and to rebuilding our economy. As we prepare for a school year that will look different from any other, we have to ensure that school districts can safely support students. That means providing guidance and resources, not threats, to help school districts put in place safe plans that work in their communities. On all of these priorities, our communities cannot afford to wait any longer. We need bipartisan action now. Thank you.